Welcome to the debate on the topic of empowerment versus care for individuals with autism and various disabilities. Our topic is going to focus on the pursuit of self-sufficiency and independence, as it is highly valued in our society and is reflected in many legislative laws and funding initiatives associated with individuals with disabilities. Despite efforts, research findings support the fact that individuals with disabilities are not afforded the same opportunities as those without disabilities in determining their post-school choices and outcomes. Instead, people with disabilities, especially those with severe disabilities, often find themselves trapped in a system of care where their post-school choices are determined by others because of barriers related to attitudes, funding, rehabilitation, and health care. On the other side, service providers are concerned with issues related to liability in service provision. We will consider both sides of this issue. This will be conducted as an informal debate. We chose this format in order to promote discussion during the debate. My name is Sage, and I will be our introducer and fielder for the group, providing potential questions regarding the debate topic. Abby will be the summarizer and researcher for the empowerment side of the debate. She will be responsible for presenting points and counterpoints during the debate, as well as providing relevant research articles pertaining to the points of debate. Whitney will be the summarizer and researcher for the care side of the debate. She will also bring research in regards to the points and counterpoints presented in the debate. I would now like to introduce the other members of the debate. We have Abby on the empowerment side.
Hi.
And we have Whitney on this side concerning care.
Hi.
The main topic of debate for the empowerment side will pertain to promoting independence for people with disabilities, as it is an important part of the BACB ethical code. Respecting the autonomy of people with disabilities allows for increased self-efficacy and quality of life. The main topic of debate for the care side will pertain to guiding and protecting our clients in the decision-making processes throughout the lifespan, since it is an ethical obligation of a BCBA. When instances arise that may pose a risk to a client, BCBAs need to provide support to ensure no harm comes to the client within the control of the BCBA. Now we will have Abby to present her first point on empowerment concerning laws and Supreme Court decisions.
As Sage stated, the empowerment side promotes independence for people with disabilities. There are many laws and Supreme Court decisions about the empowerment of people with disabilities. The first one we looked at was the Americans with Disabilities Act, also known as ADA, and that is a law that prohibits the discrimination of individuals with disabilities in all areas of their lives. This makes sure that individuals with disabilities are receiving the same treatment as people without disabilities. This empowers people with disabilities to be as independent as possible despite their disability. The next act that we looked at was the Individuals with Disabilities Education Act, also known as IDEA. And we looked, although there are other parts of that act, we specifically looked at the transition planning phase. And all people, this act states that all people should have access to free and appropriate public education, and it should address students' needs, preferences, and interests when transition planning occurs. So at the time of planning for transition, we need to look at what the student is interested in and have them be involved in making their own decision rather than making a decision for them about what happens after they're done with school. The next one is a Supreme Court decision called the Olmstead decision, and that discourages the segregation between individuals with disabilities and the general public. The community lacked resources and placements for individuals with special needs, so they were automatically placed in institutions, which is not necessarily the best for all people with disabilities. And 2 individuals specifically were placed in a state mental hospital they were not given the opportunity to be placed in the community, and they wanted to be placed in the community. So they fought against this in court, because they felt that their rights had been violated. And under the Title II of ADA and the 14th Amendment, they were entitled to being transferred to the least restrictive environment needed to fit their needs. This was brought to the Supreme Court, and it was determined that this was a form of discrimination, and keeping people with disabilities in a very restrictive environment and not allowing them to be integrated into the community discriminates against them and does not empower them to be as independent as possible. We have a visual that states, it goes over the Olmstead decision. So basically, just to summarize, all care must be provided in compliance with ADA and the Olmstead decision. The intent and spirit of the law is that people with disabilities have the right to participate with their non-disabled peers in all aspects of society, including access to health care.
Okay, thank you, Abby. In summary, for the empowerment side, laws and Supreme Court decisions concerning ADA and preventing the discrimination against individuals with disabilities was in place so that individuals with disabilities feel empowered and are able to have control over their own lives. She also mentioned IDEA and how people should be able to have access to free and appropriate public education, which address the students' needs, preferences, and interests when transition planning occurs. And lastly, she covered the Olmstead decision, which discouraged segregation between individuals with disabilities and the general public. And it was determined that prior to this, it was a form of discrimination to keep people with disabilities in a very restrictive environment. Now we will have Whitney to present her counterpoints for the laws and Supreme Court decisions regarding care.
So on the care side, while there are laws protecting individuals with disabilities and their choices and self-efficacy, there are also laws protecting professionals in regards to treatment. So these laws state that we need to use evidence-based practice in all of our treatment practices, or at least it's the best practice to use evidence-based practice. That protects you from any lawsuits because you can show the evidence behind what you're doing. So a lot of interventions that we use are to help people with disabilities become more empowered and have more independent living skills, but we need to make sure that we have the research behind it to back us up. There are also no clear guidelines on how to allow patients to make decisions for themselves. There are no guidelines put out by the BACB or other boards. So there are no guidelines for BCBAs when looking and having our clients make their own decisions if those decisions turn out badly. So while they have the right to make bad decisions, we need to make sure that we protect ourselves as healthcare professionals when those decisions are made, and make sure that we've done everything in our power to for them to have as much empowerment as possible. Also, regarding the implementation of Olmstead, Abby mentioned or talked a lot about the Olmstead decision. And in 1999, when this came about from the Supreme Court, there were lots of plans for our states to be able to implement this decision. So states were supposed to come up with resources to support people with disabilities to live in the community safely. There has not been a very good implementation by the states for the Olmstead decision. There's no outline for states of when they should have had a certain number of housing opportunities or job opportunities for people with disabilities, and therefore the states have kind of fallen behind on the Olmstead decision. Without the resources in the community for individuals with disabilities to live safely and effectively, it's not fair for them to live in the community if they don't have these resources for them. So a lot of states have Medicaid resources for attendant care and but there just aren't enough so that every person with a disability can live in the community. So while the Olmstead decision was a great Supreme Court decision, the states have not done a very good job of implementing it. Therefore, we cannot protect our clients and ensure their safety when promoting independent living in the community. So the second point that I want to bring up is in regards to ethical codes that the board has put out for all BCBAs. The ethical code I want to cover is 7.02, ethical violations by others and risk of harm. So this ethical code talks to us about protecting our clients from harm. So while there are no clear laws or instructions regarding patient-centered care and empowerment, we need to make sure when making treatment decisions, we include our clients, but we also make sure that they're making the best decisions to keep them safe. That is a top priority as a BCBA, is to protect our clients and make sure that they are making good decisions. One of the decision processes that they may need our help on is resolving conflict. So conflict with parents, conflict with peers, conflict resolution interventions are all over, but they're definitely necessary when working with our clients with disabilities to make sure that they have the tools that they need in order to live independently. So as BCBAs, we're also all mandated reporters. All healthcare providers are mandated reporters, meaning that if we see a situation where we feel our clients are being abused or aren't making the right decisions and that could lead to their harm, we need to report it to the proper people. So whether that be the police or our supervisors or their parents, if they're still living in the home and are under the age of 18, being a mandated reporter means that we have to care for our clients. It's mandated. So those are the ethical codes that we use when deciding whether or not to care, when we're caring for our patients.
So on the empowerment side, there are also ethical codes that promote the empowerment of people with disabilities. So the first one I wanted to discuss was 2.05, the rights and prerogatives of clients. So this basically states that the clients need to be informed before any treatment goes on, or they need to be informed about what is happening and give consent for that. The next one is 4.02, involving clients in planning and consent, which basically goes over the same thing. It's their right to know what's happening with their treatment plan, and they need to give consent for that and be involved in the planning. So for transitioning, they need to be involved in the planning. It can't be decided for them. The last one that I wanted to discuss was 9.01, conforming with laws and regulations. And that kind of goes back to what we had talked about in the beginning, ADA and IDEA, that as BCBAs, we need to be following those laws, and those are empowering people with disabilities and giving them independence. So we need to be following those. The next thing I wanted to talk about was autonomy and how that increases the quality of life in people with disabilities. So Gerhardt discusses how the resources and therapies that are available are not being used to the best of their abilities to help adults with disabilities. And it's shown that people with disabilities have a decreased quality of life. I have a chart to show that. So this table shows the health-related quality of life mean scores among children with special needs and children without special needs. And as you can see on the chart, it shows that people with special needs have a lower quality of life for most of the different things that are discussed in the chart. Green also stated that parents thought that if their child has disabilities, they're less capable of making decisions for themselves. So they tend to be not given the choice to make a decision, which also decreases their quality of life. So it's important to give them the decision and empower them to be independent so that they do have a better quality of life, since it is shown that people who have more independence have a better quality of life. So on the empowerment side, we talked about the different laws and Supreme Court decisions involved in the empowerment of people with disabilities, as well as the ethical codes and why it is important for autonomy of people with disabilities and how that increases the quality of their life.
So going off of what Abby said about quality of life for people with disabilities and the increased autonomy correlating to an increased quality of life, we also have to look at increased quality of life happening when we're caring for our patients. So Rand and Malley did a research study on factors associated with care-related quality of life, and they found that individuals who were cared for with intellectual disabilities tended to have a higher quality of life than those left on their own. So another good point is that treatment ultimately leads to empowerment. So one of the main things that we're trying to do as BCBAs is empower our kids, but we also need to do that by giving them the resources that they need in order to make good decisions, to have good quality of life. So without treatment and without care, there is no empowerment. Many of the interventions we use aim to increase their independence. So we work on interventions for toileting, which is increasing independence, hygiene skills. For some of our more advanced clients, we work on money saving and budgeting and how to live independently in the community and go to the grocery store, make good meals. So all of these things that we're doing in our care model are eventually, hopefully, leading to empowerment. That's the whole purpose of caring for our clients. So without someone assisting them in this treatment, without BCBAs, without us implementing the interventions and coming up with these interventions, empowerment just isn't obtainable. So guidance when making decisions for our clients hopefully will lead to autonomy later in life. So when we are able to guide them in tough decisions, hopefully they'll be able to use that later in life when decisions come up in the future that relate to that topic. I think it's also important to talk about the financial burden of living with a disability. So there are charts that I will show you that show living with a disability is more expensive and can be more expensive with age. So through the lifespan, your cost of living is going to go up. So here we have a chart talking about the cost associated with having a child with a disability. So as you can see, the cost to family members can increase over time. So the costs such as exactly what it costs for them to live with the child with a disability, as well as decline in hours worked. So when you live with a child with a disability, you have to possibly call out more. It's harder to find childcare for your children with disabilities. You may also be more fatigued, so therefore your labor force participation is less, as it shows here. Your future earnings are going to be less, and the health and well-being of your family is going to go down as well because you're putting so much into the care of your child. So it's also more expensive for social programs such as Medicaid, SSSI, which is a supplemental income for people with disabilities. Special education is more expensive, as well as early intervention programs. There's also, one second. a chart showing the average amount spent for people with disabilities or with autism specifically through the lifespan. So as you can see, it increases with age. So after looking at those charts, we can see that living with a disability can be more expensive for our families. And so making sure that there are programs, if we want our people with disabilities to live independently in the community, we need to make sure that they have the resources to do that. So a lot of our clients are going to be employed in sheltered workshops that don't necessarily have to pay minimum wage. So therefore, they're not making enough money to live on their own. And while there are housing voucher programs for people with disabilities, there are often very long waiting lists to get into low-income housing. We also need to look at availability of attendant care. So for our clients with physical disabilities or intellectual disabilities needing a care attendant, Medicaid will pay for these services, but there are often, in most states, very long waiting lists for these services. So without the resources for independent living, it's not something that we can expect our clients to achieve. So while empowerment is great, we as a society need to create more opportunities for people with disabilities to live in our community and have more options for them available so that their quality of life is increased, their autonomy can be increased, but we have to care for them first.
Well, thank you both. And as you can tell from these points that were brought up, empowerment and care is still an often argued topic for individuals with disabilities, because on one hand, you want them to, maintain their rights as a human being and be able to make choices for themselves. And on the other hand, you have to uphold your ethical codes and rights to making sure that the client is safe and is cared for ultimately throughout their lifespan. So a question that is often brought up related to this topic for Whitney is, to what extent does empowerment overlap with care? And can care, as in guiding and protecting clients in decision-making processes, facilitate empowerment?
So I think I touched on this a little bit when I was presenting my points, but I think absolutely empowerment overlaps with care. So as I said, as BCBAs, we're creating interventions to increase the independence of our clients. We're caring for our clients in order for them to be more independent in the future. So with care, we are hopefully increasing their empowerment. So care, such as protecting clients in their decision-making processes, making sure they're making the right decisions about their diet, healthy foods, budgeting for independent living, leads to them being more independent in the community. However, without care, that can't happen. So I think it's important to remember, though, when you are caring for your clients and creating these interventions, that you do want them to have as many choices as possible, that they are human beings that have the right to make their own decisions, but making sure that they have the tools to make the best decisions for themselves is important.
Well, thank you all for joining us on our debate concerning empowerment versus care, and I hope that you all enjoyed our presentation.